Fatih, and also thank you, Petra, for the introduction. And thank you for the first invitation also to contribute in this event. Hi, nice to meet you all. And hi, Kai, hi, Pranay. It's nice to meet you too. So I think I would like to share some short presentation. Can you all see this, my slide?
Yes.
Yeah, okay. So yeah, maybe I will start with the introduction. Although Petra had spoken before in the opening, but maybe some of you haven't been joining the event at that time. So maybe a little bit of more introduction about Pulse Lab Jakarta. So we established in 2012, and we employ a mixed method approach, which harness the use of data analytics, also human-centered design, to make sense of the data analysis for the policymakers or our other development partners. And this, so because data cannot speak for itself, right? It has to have this human who will be the user, but also human who's analyzing it to then produce the insights that can be used for policymakers. We are functioning in 3 streams. First, we drive exploratory research on new insights from unconventional data sets. What is unconventional data? I guess all of you are quite familiar also with it, which we often also call big data, and all the data that are not produced by the conventional methods like survey or national statistics. And the second is that we facilitate partnerships between governments, development agencies, and private sectors to optimize the use of data sets. So these are also for the data sets that are coming from the government, but also from the private sectors and other sources. And the third, we identify new data sources and the potential for development while ensuring that the use is ethical and it covers privacy of the data owners and in itself. Sorry. Okay, so this is the journey of our data. First, in the 2013, what we want to introduce our presence with saying that we are the Big Data Innovation Lab. But what was big data means by that? At that time, maybe it's easier to introduce social media data first, because this is something that the government or our partners are more familiar with. So we experiment with this data sets, and then in the development we use more variety of data sets, which is including qualitative data, and then the crowdsourced data sets, and we also use satellite imagery and ATM transaction data, but also we still use the conventional data sets as a basis for the ground truth our analysis. And this is the engagement that we are developed during the years. There are some data sets that we can get from open source, but there are also some data sets that we must establish a proper NDA or a proper data licensing agreement or to cover the data sets, and also to cover the data owners and also us as the user to analyze the data sets so that it is of the ethical use. So moving forward, the lab has been identifying our impact through this impact creation logic. We have 3 teams in the lab. Petra is our head of office, and we have data innovation and policy team. We have social system team and the partnership and advocacy team. So in these 3 teams work hand in hand to create impact for the lab. While we categorize the data innovation team as those who's working in the solution space, and those in social system team working in the problem space to identifying problems that can then solved by the solutions. And in the identity space, we want to foster partnerships and also advocate our work to create a bigger impact. Yeah, so this is the further explanation on how we are working. in this team, then we create prototypes. In the data innovation and policy team, we create prototypes, we provide technical advice, advocacy inputs, and semi-embedded systems. And then we working together with the social system teams to then do the qualitative analysis, but also doing the user research to actually find the actual problem and the need of the partners in order for them to use the solution for the to answer their policy questions. And in the third team, in the identity space, we collaborate with government partners, private sectors, because those are most of data sets, especially when you're talking about unconventional data sets, most of it are owned by private sectors like Facebook, Google, let's say, or even the smaller startups that have also fruitful data sets to use by the policymakers. Then we also do a public communication to communicate our work that can be more understandable for our user, but also our partners. In relation to today's theme in Data Indo Week is about the Big Data and COVID-19 initiative, the lab has been working on several themes and multiple issues, including urban mobility and then financial inclusion and special humanitarian and disaster response and food agriculture. But there are also other work that we're doing which is not included in the 4 teams. However, with the COVID-19 pandemic, there are so many things that are urgent that we need to answer to. So we would like to highlight our work in this COVID-19 initiative in this session. So first is the West Java COVID-19 risk map that we were developing together with Bappenas, the National Planning Agency, and West Java government. So at first, the need from West Java is for them to do a micro lockdown, like a micro quarantine. So instead of doing, Indonesia that never had a national lockdown, the lockdown was done by at the provincial level, but then they want to see whether can it be done at the micro level, which is in the sub-district level. At that time, it was in the early pandemic. From that need, then we try to combine big data. We use the waste mobility data sets and Facebook population density data. But also Facebook has this stay-at-home metrics that we then combine later on in this analysis. And we combine it with the conventional data sets, as I mentioned earlier, that we still need the conventional data sets to ground truth the analysis. So we use the data from the national statistics, which can capture the facility of the health facility and the transportation, the sanitation in the area to see how risk is an area with such density and with such movement between the areas. So we can identify the vulnerable villages in the West Java region. But I think what's more interesting than developing this interactive map is also when we hand it over to the West Java government, they see that this map can be adjusted or can be further developed to answer the other policy questions, which is how do they allocate the rapid testing toolkits, for example, and when they plan for a school opening, which area can be opening the school first, which area cannot. And this is something that we're doing through our user research or qualitative research process with the social system team. And the second work is the baselining assessment of COVID-19 report. So we look at the effectiveness and consistency in COVID-19 is being publicly reported through official websites. Because the reporting is also done by the local government, and in this terms, it's a provincial government. So we have 34 provinces in Indonesia, and each of the provinces have their own standards and protocols in reporting the COVID-19. What we do here is we map out which provinces had addressed the issues of interoperability, the standards and protocols to present data sets, but also the human capacity behind the team at the provincial level to then report the COVID-19 case. So this is not to say that the red province is those who do not report COVID-19 cases, but more on whether they provide open API in their data sets. So we as a third party who doesn't have a direct relationship with the local government can access their data and present it to public to inform public about the situation of the COVID-19 itself. So we see that several provinces already have this capacity to present a data that can support the interoperability in the national level, but also presenting in a good standard and protocol and have the adequate human resources. But as you see, there are some gaps between provinces. This is something that we currently also developing, that we can then from the baselining work and the West Java, then we see that there are also this opportunity to use big data to analyze the effectiveness of policies. What is the correlation between different types of containment and policy response to the movement or to the increasing of positive cases. So we use the Google dataset. I think most of you know the Google Community Mobility Report, which is available publicly. And this is to see that the movement in the residential area, in the retail and recreation area, parks, transit, and in relation to the positive cases in some areas. So this is the analysis we're doing is in West Java. So we see that there is a timeline here where we can put the policies that are publicly announced by the government about the closing temporarily public places, for example, or there are working arrangements to work from home, and what is the impact of these policies to the people mobility. And as you see, maybe there is not that much of difference, but when there are many policies, the integrated policies, not just this one restriction, the green part, the case movement is relatively slower. At least that is the first insight that we can get from seeing this data set, from seeing this graph. That maybe there are the policies cannot stand on its own. It has to complement with the governance and socioeconomic policies, also social distancing measurement, instead of just the public health measures. So these are the things that we're still trying to analyze further. This is a work in progress that we still need to ground truth, but this is some potential moving forward that we see. So as we want to move beyond prototyping, there are some considerations or challenges, as Parvati mentioned earlier, on how to make impact with our prototypes. So at first we have to define what kind of impact that we are trying to achieve, whether it's methodological, where our government counterpart or our development partners change their methodology in making a decision, or using, for example, data-driven decision-making. So that is to say that there are changes in methodological in their working arrangement or in their policy-making process that we want to achieve. And second is whether we want to achieve operational impact. So like, for example, our work in West Sumatra and in Medan, we want to see what is safe transit for women traveling at night. So in that research, then we kind of want to achieve the impact that the local government change their operational to design their cities not only as a smart city, but also a safe cities for women. And the third is ecosystemic impact. I think this is how we also want to contribute to the discourse or the work or any ecosystem about the discussion about data innovation and a mixed method approach in decision making in the government. And the second, we have to consider about the scale of disruption that we will create or we want to create in the system, in the ecosystem itself. What is the scale of disruption that we are willing to take and the government are willing to take, or our development partners are willing to take, because then that would be essential when it's so cool, it's so uh, yeah, it's so wow, this is a new thing, but the scale of disruption is too high that the uptake or the embeddedness level will be lower. So there's something that we have to balance. So I'm talking about the third consideration, which is the level of embeddedness into existing systems. So whether this prototype or this analysis can be embedded in the system, how long and how deep into the operational of the process for the system to be embedded in our partners. So we have to always balance it between the level of the scale of disruption, but also the level of embeddedness to ensure the sustainability of the solution itself. And the fourth consideration is the level of existing or required technical capacity to absorb and operationalize within the system. This is also something that we learned from West Java, but also our other counterparts, that prior to having to develop this prototype, that our partners also have the awareness to allocate resources to then to develop the similar solution that we have. So in that sense, then when we handed over the prototype, it's not there just for the sake of prototype, but those existing resources and required technical capacity are already in place in order for them to not only having the prototype, but to operational it in their daily needs, for example, but also for them to start a critical thinking in if this thing can happen in if this tools or methodology can answer such policy question, maybe it can also be used for the other policy questions. And the last is the availability and possibility of alternative adapters. So in doing our work, sometimes the prototypes or the solution, it has a low embeddedness in the partners. But then we also map out who are the other potential partners, alternative adapters that can also use this map with a little tweak or a little adjustment on the analysis that can, so that they can use these tools. So this is also something that when we develop something for our partners, it shouldn't be exclusive. We have to work in a non-exclusive basis, but also ensure that it is shared to public for learnings, for a wider audience to learn, but also wider adopters to also use this solution if possible.
So I want to really piggyback a bit on the last presentation and talk. One of the things, of course, about COVID, I think many of us have been working on big data or trying to leverage better sort of digital insights for decision support for a number of years. I think what's really happened with COVID, it's accelerated that in some ways. So I think what we tried to do also in terms of COVID is to rapidly sort of bring together, particularly a number of the initiatives and other things that we've been doing over a number of years to get at some of the other more mainstream SDG challenges and bring them to bear on the socioeconomic aspects of COVID. I want to just say there's been a lot of innovation, say, around the immediate effort of response to COVID, both the epidemiological, if you think about the apps and the other development that was being done. What I think we tried to do for an initiative that was the Vietnam Big Data Observatory for COVID is actually with a number of our colleagues is bring together a series of sort of big data, what we were calling big data assets, and trying to think a bit about, you know, to what extent can they inform different phases of the COVID pandemic. And what you see here is a graph that we adopted from our sort of more classical work on disaster response, right? Where you sort of have demands for public action, and some of them are very much immediate, the emergency response. You have to save lives, you have to address it immediately. Then you have a sort of recovery phase, which can even be rebuilding and others. And then you have a resilience phase, which is the build back better. So I think when we were thinking about the big data and how we're applying a number of these resources, we were trying to think about it as sort of across the span of these sort of different phases and putting the development of big data into that regard. And I think thinking about the resilience is, I work a lot with governments, is how can we make sure that beyond these very quick prototypes, we can then actually get them to be adopted within government and regular processes, right? Because otherwise you have this repeated process every time. So I think that the big challenge there has been about both how do you effectively address public action? How do you do it in a way that is actually timely enough to address any of these points? And I think, you know, but with the experience on COVID, of course, has been, I think when we drew this graph, I think back in the spring, right? Few of us would have thought both how long it would take. I think we were all thinking, well, we'll have a sort of few months, but that in many countries we've seen very, very different patterns. So I want to sort of, you know, I can talk a bit about some of the work that we were doing through the COVID Observatory and how we were grouping it. But I want to maybe say bring two perspectives to the idea of big data for results. And I think you know, Vita has already spoken about, you know, how you can bring some big data to bear. But I want to sort of offer you kind of two perspectives on how we think about bringing together these more longer term areas. And the first one I think is opportunistic. And we often also do this at hackathons or others, which is, you know, what assets are available, sort of what data is actually available. So a lot of us learned to use the Google data and the Facebook data and the others because frankly, it was available or it was made available during the pandemic. I think we've also worked with governments to then open up data sets which we knew were available, but they really needed that nudging in the context of the crisis to open up. So there was a lot of discussion around access, institutional, but also technological aspects to data access. It was a big theme, I think, that we deal with, and we talk about that. But I think from us, and you know, I'm an economist, but I've always used sort of data. A big issue had been you're trying to use big data that is really not designed for the original purpose. The World Development Report, for example, this year by the World Bank does a big development report every year. This year's theme is actually data for better lives. So it's about data generally, but it makes a useful distinction between, say, public interest data sets and privately generated data sets that can have a public interest impact. So typically we think of data collection in the public interest, like the traditional data collection, like censuses, household surveys and others. They're designed for a purpose, right? They're designed for a measurement, but the problem is they can often be quite slow. They don't address the issue at hand. So a lot of folks have turned to sort of big data, but because it's sort of being generated. So think about the example of Google and Facebook. The Google data was not designed to basically address questions of whether policies are working in a micro level, whether it's West Java or whether it's Hanoi or Da Nang. It was designed for another purpose. So we have to spend actually a lot of time to try to understand in the analytics, what's the signal and what's the noise. So a lot of the work that we've been doing, again, I won't go into details, but we can give examples, has been trying to understand under what circumstances does a data set actually give you signal and noise. So let me give you one illustration. The Facebook data, which is available at fairly low levels of granularity if you sign the data partnership agreements, you know, they provide the data in tiles. So you can do a lot of very interesting things in terms of mapping it to administrative boundaries and where the decisions are currently made. The challenge is if you use the data in certain areas, and I'll talk about Vietnam in Ho Chi Minh City or Da Nang or other places where you have high levels of smartphone penetration, you're getting signal from that data, and there are methods to do that. But if you're trying to use this data in Papua New Guinea or Timor-Leste, you better be careful, particularly in rural areas, that the data may not be giving you signal, just because there are too few users or a number of other things. So a lot of the work has actually been going in terms of the analytics phase. The second is the application, and that's the sort of so what, right? So we all were showing that we had mobility, say, going out from Jakarta into the rural areas, and we were doing it. But early questions were, so what? The big data is telling you something, but what are you using it for? So I think we had to show the sort of application value for decision makers who often have who lead very, very busy lives, right? And basically want to get to resolve a problem. And you're trying to explain sort of the intricacies of signal to noise ratio from big data, and they just want to know, well, what the heck is this telling me? And I think this point about getting to applications has been quite important, and then final adoption. So let me flip that one around, right? And this is sort of the progressive one. So the opportunistic one is you start with data, whether it's Facebook, and you can see, can you make it sing and can you make it applicable? The flip side is you have then a more kind of progressive approach where it's really a building block. You ensure the access to data, you ensure the analytics adoption, the wider use. So I think that one of the skills for bringing big data together from both an institutional and a technological point of view, and events like this can be very helpful, is you need to address all 4 stages, right? And there are different ways to do that. So let me just very quickly, we used in the Big Data Observatory a number of data sets ranging from the classic data that's just been discussed on the mobility data, some local data sets in Vietnam on commercial vehicle tracking, but also NO2 data and nightlight satellite data and other administrative data. Just for the sake of time, I'm not going to spend, and of course we were then able to generate exactly the types of graphs I think that you were discussing in Indonesia. One of I think the big things that we tried to do or have been trying to do is to use the crisis not just as a one-off, but to create replicable scripts across countries. So what you see here is a comparative graph for Indonesia, India, and Vietnam that basically tracks policy stringency. This is something measured by Oxford Analytica, basically putting together data and then overlaying it with the type of Google Doc data to see Google data, but also Facebook, Nightlights, and others to see whether we're getting patterns. But I think a big takeaway here has been, if you do this for Indonesia or India, and you set up the scripts and you set them up in a way that can be shared very easily, it's software that can be rapidly replicated if you have the data pipelines up. So I think this point about scalability. Let me just get to my final slide, just to kind of make, I think, a more procedural point, but just also to say that we've recently, for example, applied the data platforms that we were doing for COVID for the storms in Central Java, right? So we found that the lessons that not in Central Java, in Central Vietnam. As you may recall, Central Vietnam has been hit by quite a number of storms in October. So we basically redeployed the same COVID assets to basically look at storm impacts. So let me, I think, come to my final slide, and I think it's a more process point of view, but for those of you who have joined the hackathon and are super engaged in this, I think I want to applaud the event and do this. But I think this is more from the perspective of where I sit, in an international organization and working particularly with my government counterparts and with my specialists, is how do we bridge the sort of so what and the how? So many of you who are joining this event are specialized in data access, engineering, data science, visualization. You bring incredible technical skills to the table. But then how do you kind of have that deepened dialogue with what we call at the bottom, the domain specialists, right? The so what specialists. So what will this tell me about my problem statement and others? And I think this has been an internal thing that we've had to manage in terms of providing timely decision support, where you're managing a number of things at the same time. You're trying to address access, analysis, application, and adoption, and you're having to sort of manage different technology and institutional setups, and a health sector specialist that's saying, what is this doing? And it's not always an easy task, but I think it's something that we collectively have to do, and I think we've been trying to do. But again, COVID, I think, has given us a good push. But I think now events like this, I think, will let us get through these multiple iterations to really make progress on that and move across the full 4 steps. Thanks very much.
Thank you so much, Parvati. Thank you so much, Vita and Kai, for your inputs. I think my perspectives are largely going to be from the side of a decision maker on how do you leverage data in order to make decisions, in order to take forward data-driven decision-making agenda, which became very apparent and which became very important with the upcoming of the pandemic. So before I delve into the nuances of what we do, Just a briefer of what the National Health Authority is and what the Pradhan Mantri Jan Arogya Yojana scheme is all about. So National Health Authority is the nodal entity at a central level in Government of India, which manages the world's largest publicly funded healthcare insurance scheme. The scheme is called Pradhan Mantri Jan Arogya Yojana. And if we can move to the next slide, the nuances of the schemes are that 40% of India's population is covered under the scheme, which is about 500 million people. And all these people are provided with a coverage of rupees 5 lakh for secondary and tertiary healthcare benefits, which ranges to around 1500 odd packages in 23 to 24 odd specialties. The scheme of this magnitude was unprecedented. So just to give you a perspective, the number of beneficiaries in the scheme is more than the total population of US, Mexico, and Canada combined. So this is the scale at which the scheme operates. And the scheme was launched by the Honorable Prime Minister around 2 years back. And since the past 2 years, if we can just go to the next slide, the impact that we have brought in is that we have around 23,000 hospitals across the country who have been empaneled with the scheme. The good part about the entire empanelment bit is that 48% of the empaneled hospitals are private hospitals. Now, in a country like India, around 70% of the healthcare expenses are borne by the private sector, and 70% access is provided by the private sector. With the coming in of the scheme, it was extremely important to involve the private sector in the implementation of the scheme as well, because private sector ensures access and at the same time ensures quality of care across the country. So we did not want the beneficiaries who were there to just avail the services from a government facility. And that is why the private sector was involved, and private sector has been instrumental in ensuring the success of the scheme. Just to give you some numbers on what we have achieved in the last 2 years. So we have done close to 1.4 crore treatments, which is around 40 million treatments worth 17,000 crore. Which is around 2.5 US dollar, 2.5 billion US dollars. And we provide one treatment, one free treatment is provided in every 5 seconds. And since I told you that secondary and tertiary illnesses are covered, so 55% of our amount has been actually used in tertiary cases, which typically cause catastrophic health expenses, right? So this scheme has not only been a huge benefactor for ensuring quality healthcare, but at the same time, this has been a huge financial protection scheme. It has not only impacted SDG 3, but it has also impacted reduction of poverty and ensuring gender balance, given the fact that around 50% of our beneficiaries are women. So the scheme was going in well. The numbers were going in great until the pandemic came in sometime in early March in India. And if we could go to the next slide, one of the main indicators for the success of the scheme was that we had created a robust data monitoring and evaluation system. So the entire scheme is a cashless and a paperless scheme. And we had created dashboards in order to track anything from a micro perspective to a macro perspective, right? So from a individual hospital related or a beneficiary related information to information at a national level, we had an entire robust data system and data infrastructure set. And right from the first day, the monitoring of the dashboards was happening right from the CEO level in order to have data-driven insights, right? Kai and Vita both were talking about how do we ensure that data analysis is resulting in data-driven interventions as well, and the necessary policy decisions are made. So I think we realized it very early on that an insurance scheme covering 40%, 50% of India's population needs to have a robust monitoring mechanism, and the decision making needs to be informed by data. So I think this entire dashboard suite that we had developed came in very, very handy when the pandemic struck in. Just to give you guys a perspective, our numbers reduced by close to 60%, the number of admissions that were there, because people were very scared to go to the hospital when the pandemic came in. And a lot of hospitals either became COVID care centers, wherein they were not having people who were availing optional treatments, or a lot of private healthcare clinics had actually faced a huge financial crunch because of the fear of the people availing treatment, and many clinics unfortunately had to shut down their businesses for a bit because of the crisis that the pandemic brought in, and this was very reflected in our numbers. And while some decrement in the numbers was expected, but a 60% decrement was a lot for us to also look into. And we had to quickly garner our data insights team, and at a national level we were analyzing trends, and we were looking into how can we ensure that the demand supply gap is curbed as early as possible, and how can we look into creating more evidence-based, more data-driven policy making. And as Kai was mentioning about the short-term emergency measures and the medium-term measures which will ensure sustainability of the system. So the next two case studies that I'm going to present are essentially going to talk about, the first case study is about the short-term measure emergency measures, and the second case study is more about how do you ensure sustainability of the interventions that are coming in. So if we could go to the next slide, Parvati. Immediately after the pandemic came in, as I was mentioning about data analytics playing a big role. If we could just go to the next slide. Yes. So the first case study that we did at a national level was to map the at-risk populations that are present at a provincial level, at a district level. And this was done by taking in two data sources that we had pertaining to population who were above 60 years of age, basis the last census data source that we had, and also marrying that with the prevalence of illnesses such as diabetes, hypertension, and other illnesses which require timely intervention. So if you look at the left side of the graph, it is essentially engaging you and telling you the demand side of it, right? What are the hotspots, what are the clusters wherein the demand is going to be higher because of the virtue of at-risk population. And this is the population which is going to impact your mortality rate as well, because if we look at the COVID mortality rate, it is typically skewed towards people who are in the vulnerable age plus illness bracket. We then married the demand graph to the supply side intervention in terms of the number of healthcare facilities and the number of testing labs that were there. So initially, we had to start with the testing labs in the bigger cities that were there. But I think marrying the demand and the supply gap helped us realize what are the potential hotspots which are bound to see an increment in cases, and how setting up of labs or setting up of necessary infrastructure or having more COVID care centers in those areas could help us in managing the demand supply bridge. So this was the first, one of the first exercises that we had done right at the onset of the pandemic, and this was shared with the necessary stakeholders in the government ecosystem, within the government ecosystem, in the necessary department, so that the infrastructure could be put up, and if there were any infrastructural gaps or if there were any human resources gaps, those could be flagged and those could be catered to as soon as possible. And this was quite useful in the lockdown phase. So for those of us who are joining in from India had a roughly a 8 to 12 week intense lockdown period, wherein the supply chain was broken. So in purview of that, this analysis played an important role in ensuring that the demand supply bridge is curved to as little as possible. If you can go to the next slide. The second case study that I want to bring to your notice is that the National Health Authority, as I was telling you, that we cover around 1,500 odd packages in secondary and tertiary illnesses. And with the coming in of COVID, initially we did not have a package for COVID, right? Because the onset of the pandemic happened at the go, and there was nothing like a COVID that was in existence. So what we did when the pandemic started was also that we revised our packages to include a COVID specific package, because we cater to the 40% population, which is the most vulnerable in the country. And we did not want them to spend a lot of money in testing and treatment, because access to healthcare also has a socio-economic angle to it, right? If the people in this panel are facing any calamity, we are bound to have the best in-class healthcare resources at our disposal. But the kind of beneficiaries that we cater to might not have the necessary financial protection in order to avail services. So we included a COVID package. But at the same time, in order to have a more nuanced understanding of how the disease pattern is emerging in and around the country, we also started analyzing acute respiratory packages that we had. So we had around 6 to 7 packages, which were dealing in the pulmonology specialty, which were looking into acute respiratory illnesses and the like. So a combination of COVID packages and the acute respiratory illnesses packages gave us and still gives us a very good idea of where are the beneficiaries who are availing the treatment under the Ayushman Bharat PMJ scheme. And from a national level, we then have a freedom to go to the respective states by marrying this data to the COVID data that is coming up on the number of cases that are coming in from each state and each city, and looking at if there are X number of cases for COVID coming up, then Y number of hospital admissions should happen on the basis of the previous historical data that we have. So from a national perspective, this data source has given us a very good indicator to talk to the respective states, to get the confidence of the provincial governments as well, and enable healthcare policy to be carved out at a provincial level rather than at a national level, and rather than being very, very prescriptive about what needs to happen, right? Because when we are talking about decision making, I think decision making is also a function of autonomy that the last mile stakeholders have in terms of bettering the healthcare outcomes. So these are the 2 case studies that I kind of wanted to share for the benefit of the panel. I also, before I conclude, I also want to say a few things at a governmental level. I think what Kai was mentioning was really insightful. In that is that while the government is concerned about how robust the data analytics parameters are, and how well a particular study is done, I think the more important thing at a government or at a decision maker level is also what actionable insights can a decision maker take. And this requires the governments to work more closely with the external ecosystem, and the external ecosystem to also understand wherein government priorities lie, right? And actionable intelligence, if provided in a format which complements government's work, can do wonders, not only in the mitigation of COVID, but also we are likely to have the vaccine come up in the next couple of months. And for India particularly, the challenge is going to be, how do you vaccinate 1 billion plus people in as less time as possible, in as efficient way as possible? So in that situation, I think it is going to require collaboration. It is going to require all the stakeholders coming together, removing the information asymmetry that exists in the system, and working towards the common goal of getting away from the pandemic and beating this pandemic as soon as possible. So I think these were my parting remarks that I wanted to make, and happy to contribute to the discussion ahead along with the panelists. Thank you.